Very special guest this morning at our 50th Coffee with the Commissioner. Of course, we have Dr. Paul Glisson. He is the Vice President of Medical Affairs at Baptist Hospital. We also have Dr. John Wade. He's with us this morning. He's a pulmonologist that I've been speaking with and who has sent an email to the commissioners. We also have Mr. Mark Faulkner, who is the President and CEO of Baptist Healthcare in Pensacola. Thank you, sir, for being here. And then we also have Janice Gilley, our County Administrator, and then Eric Gilmore, our Emergency Manager. The discussion today is all about COVID-19. It's in the news, national, local. There's a lot of information out there, but there's also a lot of misinformation. And people like me, policymakers, we're having a hard time grasping the facts through all the spin. A lot of this stuff's being politicized. So, I'm just very thankful we have a couple medical doctors here today so we can ask some directed questions. And I did have Debbie, my aide, forward you guys some of these questions. So, Dr. Wade, I'm going to start with you because I know you're very constrained on time this morning, and understandably, Doctor, the minute you have to go, please just jettison. But I'm going to ask you all as many questions as I can in the time that we have. So first and foremost, appreciate everyone being here. So we're going to change the order around to accommodate the doctors. So I'm going to start with this, Dr. Wade. What does recovery look like for these patients that are recovering from COVID-19? It's not indicated in any of our stats. It's something I've been asking about because we see this big top line number of folks that are infected, but we never hear about the recovery. So what does it look like from your experience?
Well, it's pretty variable, just like the clinical manifestations of the disease. So you have, asymptomatic or minimally symptomatic patients who oftentimes, will be better in a short period of time, days to a week. The patients who get admitted to the hospital obviously have more severe disease. And as that severity increases, meaning those that develop pneumonia and respiratory failure who require ventilatory assistance, that recovery can take weeks, if not months. Certainly several weeks in the hospital for someone with respiratory failure on the ventilator would not be unusual. Typically, after a prolonged hospitalization like that for respiratory issues, patients will need additional time to recover, whether that's in our long-term acute care hospital locally select, before going to a rehab center or from the hospital to the rehab center. So, all said and done, many patients, especially our older, more infirm patients, it may take several months really to get over this for some of the more severe forms.
And a lot of these folks that I'm hearing about, they're having a hard time getting clearance to go back to work. They're diagnosed, they go through the course of treatment, they recover, but they can't get a positive test, or they can't get a negative test, which allows them to come back to work. Have you seen that in your experience, that folks are having a hard time flushing this out of their system?
Well, no, but basically, there are two different ways that you can be cleared from the virus. And one is, the clinical pathway, which is one that is used most frequently. And that is that, for instance, if you have at day 10, even this has been shortened, it was originally 14, you've had 3 days of no fever and improving symptoms. So you had a cough, it's better, your shortness of breath, everything is getting better, but you don't have a fever for 3 days, then that is allows people to go back to work safely without a negative test. The problem with the testing is, number one, getting the test. And now with our surge and increased testing, the turnaround time is really ballooned. So it's not a very viable option. We also do know that there are patients who can continue to have little bits of fragments of the RNA, parts of the virus, in the nose, nasopharynx. And the technology that we use for the diagnostic test, the PCR test, can pick up some of these fragments and turn a test positive. So there is a little bit of a downfall from testing because you potentially could be getting a non-infectious particle of the virus, but it's testing positive. We typically more and more are using the clinical improvement time frame to clear patients to go back to work.
Do you think you've practiced, when we had our conversation Saturday, you told me you've practiced here for nearly 3 decades here in the area. Have you ever seen anything like this? There are people out there that don't believe this is real. There are people that will look you in the eye and tell you it's fake, that it's a hoax, it's political. But you're a guy that's there every day, you and Dr. Glisson and Mr. Faulkner. Have you ever seen anything like this, Dr. Wade, in your 3 decades here?
No, I haven't. And we do have influenza here, and we've had some very bad influenza seasons over the years. And that's, the flu, but then also the pneumonia that comes behind it. And we've had a lot of death with some of those in the past, but nothing close to what we're dealing with now in terms of hospital utilization, um, um, and range of illness from asymptomatic to death. It's most definitely real.
And in your experience, are you seeing folks that are able to go home and tolerate this? It's what I'm hearing, and I guess I'm glad that Mark is here and Dr. Glissen's here as well. What I'm hearing is that a lot of folks are showing up in the emergency room. Some of them are getting the first part of an IV in their arm and having to wait and wait and wait. I don't know which hospital that was, but are we seeing that folks are we really trying not to admit people in the hospital and trying to the maximum ability that we can make them go home? Anyone want to weigh in on that? Because that's something I've heard.
Yeah, I think Paul certainly as an emergency medicine physician can weigh in on this. You're absolutely right. I mean, everybody that comes in with symptoms does not need to be admitted to the hospital. And that's the job of Paul and his team, to try and ferret out, who needs to come in now or who needs to go home and quarantine and, get better at home.
Dr. Glissen, is that your experience? I mean, when they come in, well, first question is, during the summer, have you ever seen this level of people coming in with these sorts of symptoms during a summer, in your experience?
No, it's definitely unusual. And add to the fact that not only is it a disease it can be devastating, but add in the infectious component to it and the degree of personal protective equipment we have to use, negative pressure rooms, and it's just added a whole other level of complexity. And we haven't seen anything like that since we had the Ebola scare several years ago when we had a couple of patients in the United States who were bringing Ebola in, and we were worried about the infectious component of it then too. So other than that, we have not had this level of utilization of healthcare.
Well, the two doctors, and I'm so thankful you're here. I know your time is valuable. I know you guys are probably going to be working this morning, later this morning. But I want to ask you about treatments. In the news, we hear different things. We're not sure what to believe, what's really true, what's being spun, depending upon ideology. And so early on, obviously, we heard about hydroxychloroquine, and that combined with zithromycin, they said that was an effective treatment. Then it fell out of favor. We were talking a little bit before we went live about some doctors who have now come out and say they're supportive of it. They found that it works. From the medical doctors, any truth to that? Is there any benefit to hydroxychloroquine?
Well, let me speak to that. I mean, I have, you can turn on the television and see a number of physicians who have been purporting this. There have been now several large retrospective studies looking at hydrochloroquine, Plaquenil, with or without azithromycin. And the data suggests that it is not beneficial either in reducing mortality, respiratory failure, for patients, asymptomatic patients, preventing, progression of disease. What we do know about chloroquine and hydroxychloroquine, Plaquenil, are that they cause a prolongation in a thing called a QT interval. This is a part of an electrocardiogram, and when you prolong this one little segment, it can lead to lethal at times arrhythmias. And it's a small percentage of patients, but when you start to utilize a medication, for thousands to potentially millions of doses in the middle of a pandemic, a small percentage of complications turns out to be a very large number of patients. And so
right, the law of large numbers, yeah.
It's not only just we haven't found that it's effective, but that it also, there is, some danger to it. I can say that I believe probably some of these physicians who are using this, they tend to be family physicians who have outpatient practices. These are patients who are not taking care of inpatients who are sicker. As a result, there is a large percentage of asymptomatic or minimally symptomatic patients. So giving them the drug, is it helping them? Is it preventing something? Or are they going to get better anyway? And I think a large
Right.
percentage of those patients are going to get better anyway, whether they get the cocktail or not.
Interesting. Well, let's get to what everyone's talking about. And I'm going to start with you, Dr. Wade, because you sent me a very poignant email, and we talked about it this past Saturday. And it really, we're asked to make a lot of decisions in this job, and typically it's a pretty cut and dried situation. You want to do this? What does the code say? Bang, make the decision. Here in this one, none of us are scientists, right? I know nothing about pandemics. I'm not a doctor, but so when I get an email like the one I got from you, it gets my attention, because I've always said when I make decisions for my vote, 1/5 of the vote, it's going to be based on science. It's going to be based on the best information possible. So the viewers, give them a flavor of the email that you sent me and what you think we need to be doing, Dr. Wade.
Well, you know, the email pertained to the use of face coverings and masks, and you know, the reason why that should be strongly considered, and even considering, you know, a mandate for an in-public rule to utilize face coverings. You know, when we first started out with this pandemic, you know, it's a novel virus, so we're learning, and we've evolved. The science has evolved. When we first this was developing, the feeling was that the virus, if you coughed or sneezed, the virus would have a projectile almost transmission where it would go 6 feet. So if you're 6 feet away from someone, you're washing your hands, there would really be no need for a face covering. So social distancing, hand washing. We now, however, know with further research that there's ability of this virus to become airborne, to become an aerosol, hang in the air for a certain period of time. And it's very variable depending on ventilation, indoors, outdoors. But we know that certain environments, enclosed environments, elevators or small lobbies, bars, that this virus can hang in the air, and therefore is very susceptible to inhalation from the air, rather than touching a surface that has it and then, you know, touching your eye or your nose, whatnot. Therefore, face coverings have taken now on a new level of importance, and the data certainly is clear. We used to, initially were thinking that the face covering would protect other people other than the mask wearer. We actually now know there's good data that it protects both. And there's a good article out there, actually, that's in press now in the Journal of General Internal Medicine, that's hypothesizing that, you know, we now know also that the severity of disease when you get the coronavirus is likely related to viral load, or the inoculum of virus. So if you have a big inoculum where somebody sneezes or coughs in your face, certainly if it's more than once a day, your chances of having more severe disease is greater. We definitely know that a face covering, this is, you know, not rocket science. It is science, but it's not rocket science. I think it's pretty intuitive that if you have a covering over your face, you are going to reduce the amount. You may not totally prevent an infection. You may not prevent a virus from getting in or out, but a face covering is going to significantly reduce the inoculum of virus when you're breathing, talking loud, sneezing, coughing. As such, we now know that if it's a less of an inoculum, the chance for asymptomatic disease goes way up. And there was a quote of the cruise ship, the Princess cruise ship, the first one that came in. The asymptomatic rate on that ship, no mask wearing, 15%. There was another case, and I believe it was a ship out of Argentina. 2 to 3 months later, 2 months later, everybody had masks. The asymptomatic rate on that ship, 80%. So that's the type of, if we can reduce the inoculum size with masks, we have a real chance here, I think, to reduce not only the transmission of the virus, but to increase or decrease the severity. Of course, that severity is very important, because the more severe, more hospitalizations, more deaths. So I think it's pretty clear that masks save lives. And that's what I was writing to you to appeal to the commissioners, yes, to really strongly consider a mandate to wear these masks in public.
And just so everyone who's watching knows, this gentleman that we're speaking with, Dr. Wade, is a pulmonologist. He specializes in these sorts of things, and he's done this for decades. And you know, and we're grappling with exactly the best way to handle this. You know, a month and a half ago, when someone said, "Don't vote for a mask mandate," I was like, "What are you talking about? I've never even heard of that." And then here we are 6 weeks later, and everything's been evolving and everything's been changing. But Dr. Glisson, I'm going to ask you this because Dr. Wade just brought up something that as a layperson I hadn't really thought about. I thought, you know, once it gets in, whether it's one droplet or a little, that eventually it multiplies in your body, and where each person is sick to the same degree, and they fight it off just however their body would. But what he says is the amount of inoculum, I guess is the word that you're using. Explain that to people so they can understand it, because to me that's new information. I mean, I thought an infection is an infection is an infection, but what Dr. Wade said is entirely different.
Yeah, and that's what we're thinking may be associated while some people are asymptomatic, some people have varying degrees of this. It's been very baffling for us that there's this level of infection that's not been spread evenly. So there are some patients who even are young, or it doesn't really matter about their age, can be on the ventilator and in this most critical shape almost immediately. And there's others who have have a runny nose or a sore throat or a mild cough. So Dr. Wade is exactly right. We're thinking this may be why we're seeing this continuum of disease across all stages there. So, and I will say that Dr. Wade not only is a pulmonologist, but works in our critical care areas at Baptist. And if you saw the work environment that he works in, it would not be a question of of wearing a mask. It would be what mask can I wear, and how many can I wear? Because you could be looking for ways to protect yourself there when you see what Dr. Wade sees day in and day out. And so God bless Dr. Wade, because he's a very brave man to work in the conditions he works in. He's doing God's work, taking care of the sickest of the sick for us. So I trust his opinion empirically. He's dead on.
Well, let me ask you both something. And again, my apologies to Mark and Janice and Eric, but I got these guys for a couple of minutes. They got to go make their rounds. They got to, and this is the $1 million question that I've been wanting to ask, and a lot of people have asked me. Are masks more important than hand washing? And I see my understanding of this has been that hand washing is number one. The hands are the key. Keep your hands clean. Don't touch your face. Stay away from people, and you're in good shape. Is hand washing and hygiene and social distancing, are masks more important than that?
I would be careful in trying to attribute one area of more importance than the other. I think that because if we, get very compulsive about mask wearing, but we don't wash our hands, when you take your mask off, when you come into your home, and then you touch your face, you're going to get the virus. So I think it's not an exhaustive list of things to do. Hand washing, the social distancing, the 6 feet, and the mask. I think those three things together give us the best chance to mitigate, the problem.
Dr. Glisson, would you concur with that opinion?
Yeah, I think it's all part of the iron triangle of wearing the mask, keeping your hands away from your face, and hand washing, and then social distancing. We're just preventing that aerosolization to be spread between different people. So we consider it part of the iron triangle.
And let me ask you, this just came in from a viewer. Does a simple cloth mask make a difference? I mean, if you're not wearing the N95 respirator, but you've got one of these homemade special jobs, or the El Cheapo that you get for free, does that make a difference? I mean, or is it just like wearing nothing, or a bandana or a scarf?
No, I think that there's value in the cloth mask. Certainly, if we look at different types of medical masks, the N95 is the one with the most protection. The surgical mask offer less protection. The cloth mask or the vast majority of those will offer less protection than that. However, any protection is better than no protection. The other thing is obviously appropriate wearing a mask. The mask needs to go over the nose and the mouth. You see a lot of people walking around
right
with the mask just over the mouth and the nose, and that's not going to be that's nearly ineffective. It still provides something, but I think a reasonably constructed cloth mask worn appropriately is still going to have significant value.
Well, let me ask you guys this. and this would probably go to Mark as well. And Mark obviously speaks for Baptist, but not for Sacred Heart in West Florida. But the thing that I worry about, a lot of people have asked me, Jeff, what happens if we run out of beds? What happens if we run out of this? I know looking at the dashboard yesterday, we were down to like 5 ICU beds all at West Florida Baptist, Sacred Heart, and Select. We're all out. Do we have the staff, though? Do we have enough staff to continue at this pace that we're at right now? Mark, I'll throw that one to you from Baptist's perspective.
Well, there are several critical limiting factors. One would be bed availability, and we are into surge plans, which we have put together to expand bed capacity into non-traditional areas. The second would be equipment and medications, and then the third would be people. We currently have adequate staff, although I will say that we are being pressed right now with the volume of inpatients in critical care and on the med-surg floors. We certainly are stretched. But again, we have adequate capability today to take care of patients. We're certainly seeing some staff contract the virus primarily and largely through community spread, not in the workplace. I do have colleagues in other parts of the state, in Orlando and Miami that I've spoken to, Jacksonville, that staff is a major issue. They're bringing in contract nurses from all over the country, from Northeast, from the Midwest, to staff their hospitals because they can't accommodate them in terms of the people.
Okay. Let me ask you guys this. This is a question I get. I'm no longer on the school board, but I have a heart for kids. I was on the school board for 10 years. All 3 of my kids went to schools locally. There's a big debate raging about whether or not we should start school. There was this narrative that was put out that I'm not a scientist or a doctor, but it didn't make sense to me that it'll be safe for kids to be on the bus and we're not going to make them wear masks and that'll be fine. But the kids out at the beach for spring break, that was a health emergency. So how could it seem like a double standard to me? So let me ask a somewhat political question. You don't have to answer if you don't want to, but is it really safe to put these high school kids back together if they're not going to be forced to wear masks and they're going to be in close quarters on the school buses? If I had my kids, if my kids weren't graduated, I don't know if I'd be wanting to send them back. But from a medical perspective, is it safe to do it? Or are we rushing it? Any takers?
I think there's a lot of danger in doing it. And you mentioned it. It's especially for the high school kids. I think there's a little different situation when you're talking about, preschool and early elementary school, what we know about, virus transmission and disease. But, especially for teenagers, teenagers, the buses, but, they often, it's almost like there's a natural affinity for teenagers to group themselves, a dozen kids in less than a 6-foot parameter. So without mask, I don't know how you do it. I think we also need to have, better testing. Our testing, had gotten really good before this surge, but because of the surge and because of the need for increased testing, our turnaround times in general for the population in general has really skyrocketed. The hospitals, Baptist and others have done a very good job about being able to maintain that point of care testing for inpatients and for our providers. But in terms of, we really need something that's close to that, I believe, in the school systems, that and, universal mask wearing for sure, to even have a fighting chance of keeping these kids in school. It's one thing to start it back. It's another to actually to be able to keep them in school. And of course, we not only have
right.
the students, but we have the cafeteria workers, the teachers that are more susceptible maybe than the teenagers are to consider as well.
No, that's a great answer. And I love it because you're a doctor and all the rest of us, we're Facebook people that talk online, but you're a doc. What about you, Dr. Glisson? Would you like to weigh in on that?
Well, I would just say that all the healthcare facilities in the area have had universal masking requirements for some time now. I think we take this very seriously. So if you look at the example that we're trying to set for that, we obviously see importance in that. And I'll just say from my own experience, my son works at has friends that work at Starbucks, and they had one of their team members come back positive just yesterday, and the entire crew that works on that staff there were sent home for 14 days. So if you work backwards from one of them being positive, what do you do then? So if one person in your classroom comes back positive, what are you going to do about that? So when you work backwards
right.
We've had the same issue in healthcare where we've had one team member from, a team that works very closely together. And if they turn positive, am I going to be able to, can I afford to lose that entire cath lab team or that entire, ICU team because one person was positive? So that would be my advice is look at the examples that healthcare is trying to set for this with universal masking and then work backwards from what are you going to do when you have somebody who's positive and how are you going to trace that back and keep everyone safe then? So.
No, that's a great answer, and I appreciate that, guys. Well, I'm getting another mask question here. Obviously, the city of Gulf Breeze has mandated masks. The city of Pensacola has mandated masks. Statewide, they've done it in Alabama, Arkansas, and I believe about 32, 33 other states. There's a tremendous amount of pressure on us to do that locally. And to me, it's a double-edged sword. It's difficult to tell people what you have to do. It's difficult to get them to understand if they haven't been touched by it, haven't seen it, or had someone die from it. But I'm a conservative Republican, have been since I was 18. I'm not a guy that switched parties like a lot of people did. Since I was 18, I'm a Republican, freedom, liberty, limited government. But this is different. This is an issue where I'm really conflicted on it. And number one, I want more information. I want more data. And I don't think I'll ever get enough to really make the decision. I've got on one side people saying there's no science saying it works. There's not a single controlled study that says it's effective. The micron's too small. You're catching butterflies with a hula hoop. I'm hearing all that. And then on the other side, from folks who are, let's just say senior citizens or up in age or perhaps compromised, regardless of the party, they want a mask mandate now. From my perspective, if we do it, it would have to be measurable, it would have to be enforced, and it would be for a limited duration. And we would have to see if it made a difference, because what we're seeing in California is they've got universal mask mandates, and their infection rates are going through the roof. So if we have a mandate here locally, if we end up doing that, what amount of time does it need to be measured to see if it was effective? 2 weeks, 2 months? Dr. Wade, do you have an opinion on that?
I think it's more on the order of 2 to 3 weeks that you could see a change. And I understand freedom and liberty and First Amendment rights. I get that, and I'm strongly in favor of those. But you can't yell a fire in a crowded theater. And basically,
Absolutely.
The Supreme Court has come down on this, is that basically you have those rights, but those rights cannot endanger other people. Well, if you are in a crowded elevator and you've got the virus and you don't have a face covering, you are endangering those around you. That is clear as day. The science is behind that. So it's very similar to that in my mind. I can also appreciate the difficulty in enforcing a mandate, but I think that sometimes that's used as the excuse not to do that. And, I think it's worked in other states and locales. So I would still stand on the side of strongly recommending that the commission, consider such a rule or mandate.
Dr. Glisson, let me throw it to you. I was at a funeral for a gentleman who died of COVID-19 just this Saturday, and the funeral actually took place in Gulf Breeze, a community that has the mandate, right? They've patted themselves on the back, they passed it. Well, I happened to have to stop into a convenience store right there on Highway 98. I won't name it, but it's one of the known gas stations. And in my suit, I'm fumbling with my mask because I follow rules, right? I'm a rule-following guy. I'm in the city of Gulf Breeze. They have a mask mandate. I put my mask on, and I walk into the store. Two cashiers, neither of them wearing a mask. And I'm the only guy in the store as people shuffle in and out from the beach, folks that didn't, obviously not from this country, right, speaking a different language, coming in and out. Not one person wore a mask, and it wasn't being enforced. So is it better to do an ordinance, Dr. Glisson, and have it not enforced? Or is it better to, what good is that? And that's a semi-political question, but I'll throw it to you and ask your opinion. You're a doctor.
Well, I'll tell you, like I mentioned, we've had the masking mandate for some time at Baptist, and we don't have security walking around telling somebody to put their mask on. I think, and we don't really measure the infection rates to see if we've been successful with that. We really look at the culture. At Baptist, we really focus a lot on culture. Mark spends a great deal of his time just working on making sure that we work together as a team and focusing on that culture. The culture is where I would look, and not just in Pensacola, but nationally. But in Pensacola, that mandate would go a long ways to saying this is the social norm. Not that you wear a mask, it's that you put the health of everyone above just your comfort for wearing this mask. And that's when you'll know you have success, is when people say, hey, for the safety of everyone here, the culture is I wear a mask to keep everybody safe. So, looking at numbers, you can tell the success. And I would never expect a police officer to come and write me a ticket for that, but I would I think you see the success if you were a customer in that store, looked at that guy and said, hey, can I get you a mask? Can I help you? Because you're making me feel uncomfortable like that. So that's when you know you have success, when it's not the police, but it's everyone saying, this is our culture that you wear a mask. And they'll wear the mask because they're like, I don't want to be that guy who's not following the culture. So that would be
Well,
mine.
I will say, as it pertains to Baptist Hospital, I will say I had the unfortunate opportunity to be in the emergency room at Baptist Hospital in Gulf Breeze 3 weeks ago. They would not let me in the front door without a temperature check, which they did, and they provided me a mask. So I think you guys are practicing what you preach, and obviously that's a hospital. No one's going to say no. Everyone in the waiting room had the mask. And I know that lots of businesses in Escambia County are going that direction and mandating the masks, the big chain stores, the grocery stores, the big box. So, it is a tough issue that we're grappling with. Again, I go back to the fact that I don't like to tell people what to do, but this is a totally unique situation that we're in. And then, of course, you add to that mix the conflicting things that we're getting. But that's why I really appreciate this opportunity to ask you gentlemen the questions, and I appreciate you all being here. And we're going to get to Mark and Eric and Janice, but I had two more questions for the doctors, and then I'm totally understanding if you all got to go on your rounds. But let me ask this, because a lot of people have asked this. How long is a recovered patient contagious? And how long do the antibodies last in that patient, which will prevent them from being reinfected? And can they be reinfected again? Dr. Wade?
Well, so, by the clinical criteria, at 10 to 14 days, you've had the virus, you've been symptomatic, but you have improving symptoms, and for 3 days you don't have a fever, then you're considered non-infectious and able, to return to your daily routine. Certainly, there's a lot of hope around, the concept of herd immunity. As we get more and more people infected, we'll be immune from the virus. Remember, this is a novel virus. We don't know. We do know that antibodies are formed against this virus. They are probably protective. The data on that is still yet to be collected and reported and printed. But we are seeing anecdotally patients, when this is given early, because what happens is and this leads to the plasma infusion, which contains the antibodies. Those will block the virus and not allow it to actually enter the cell, which then, you don't have viral replication in the body, and you prevent or severely attenuate the severity of illness. And so there's a lot of hope for that therapy. But the data, specifically on how long the antibodies last for this virus, we don't know. We do know that similar the MERS virus and the SARS-CoV-1 virus, some of those antibodies last for MERS up to a few years. There's some concern that this one may not be as long, but then there's other immunity too. There's another arm called T-cell immunity, which we don't know yet, how robust that is. We will know more, obviously, as the vaccine research and testing develops. Obviously the vaccine is eliciting the immune response. So we'll know much more as that progresses as well.
Dr. Glisson, what is your experience being in the emergency room doctor on these folks? How long do you think that they are contagious? Do you agree with Dr. Wade? I mean, do we know?
Well, I think he's on. The evidence will still probably prove us wrong or right, but the CDC now is recommending 14 days from exposure if you have no symptoms, and then 10 days after symptoms start if you have exposure. If you have symptoms, and then at least 3 days with no fever. So we're using that just because we're having, initially this AHCA in the state of Florida had required us to test nursing home patients before they go back. And have a negative test before they go back. And then we started realizing that these patients were not testing negative, even though they have no symptoms, no problems. They've been 2 or 3 weeks out. We've had one patient, I think, was up to 60 days and was still testing positive.
Wow.
But having no symptoms. So I think the testing method is just like Dr. Wade explained, is not accurate.
Well, gentlemen, I really appreciate your time this morning. It's fascinating discussion. A guy like me, a lay person, I'm taking this in like I'm drinking from a fire hose because we got some important decisions we got to make. But final question, how long will it take for us to beat this pandemic, in your opinion? We'll start with you, Dr. Glisson. Can we beat it? How long will it take? Will we get this testing worked out? Do we have enough reagent? Will we beat this?
Well, I think it has all the potential to be very protracted. I tell everyone that I can only predict about 2 weeks out, and every day is a game day decision, and every day is game day. So we have to have a lot of the meetings and to discuss the latest data that comes out of here and make decisions every day about what we're going to do. But I do think that all the ingredients are there for this to be very protracted unless something changes.
Dr. Wade, do you concur with that?
Yes, I certainly do. We may be now seeing, there's encouragement about maybe a flattening of this surge curve, but let me tell you, a flattening is still high volume, right? I mean, and we are all trying our very best, but it's a stressful environment from a manpower standpoint, to care for this many patients. I mean, all three of the hospitals are carrying the burden, and it's tough. So I do think, if you look around the world, this is a global pandemic. Many countries, many of our allies have had success at controlling this virus and bringing it down. And that's, largely due to some of the simple things we've talked about. In terms of masking and social distancing, hand washing, those sorts of things. If we can get the curve, get the incidence of this low enough, then the standard public health approach to contact tracing when somebody is positive becomes a viable option. Now with our community spread having ballooned like it is, that approach is not possible. It's just there's too many people. So we got to get it down. I do think we can get it down, but we have to have a concerted effort. It's not going to just happen.
And will this vaccine that we're hearing about, will it be effective, do you think? It just seems it's being rushed. Would you take it yourself first?
I think that's just a big question mark right now. One, is it effective? If it is effective, okay, then we have to scale it up and be able to get. And then you have to have the buy-in. I mean, there's been a lot of surveys looking at a lot of people who are pretty skittish, about using it. So I think there are a lot of questions that are still unanswered. Obviously, that would be great if we had an effective vaccine, but we really have to push to get control of this, before a vaccine is available.
Right on. Well, Dr. Wade, Dr. Glisson, obviously greatly appreciate your time this morning. Your answers to the questions, very forthcoming, very enlightening for me. Learned some new things today, learning things every day about this as we go through. So I would love it if you'd stay aboard, understand if you got to log out, but we're going to kick it over to Mr. Faulkner now and get an update on Baptist. And again, my thanks to both of you for being here this morning. Thank you.
I will have to. I'm gonna have to leave, but I do want to thank you, Jeff, for having this forum. I think it's important. I appreciate your interest, in the issues, and hopefully, we can move forward.
Yes, thank you, sir. I appreciate it, Doctor, and thank you for being here. All right, Mark. Sorry to keep you waiting. I had to take the opportunity when the docs were on the line because they have all the answers to many of the questions that I'm getting. But how are things going over at Baptist? First and foremost, thank you for being here. Thank you, Dr. Glisson, both of y'all from Baptist being here. How are things going at Baptist right now?
It's busy, for sure. Yesterday's inpatient count was over 80, including many patients in the ICU, ventilators being utilized, and then on the general acute care floors. So we remain a very busy hospital as we not only are providing care for the COVID patients, but also all of our services are open. As we know, there are other healthcare needs happening simultaneous to this pandemic. And so we are accommodating all those needs as well as the COVID patients. So it's extremely busy right now.
And is your staff keeping up? As we heard from Dr. Wade, it does become personnel intensive with the changing in and out of the PPE? How's your staff holding up?
Remarkably well. It's an amazing team here, and it is culture. People are here doing the right things and living our values. But this is a marathon, and folks have been in this fight for 4 months. And as Dr. Glisson and Dr. Wade were pointing out, this is a marathon. We're not going to see an end anytime soon, and so we know this is going to take a while. I will say that the expressions of appreciation from the community mean so much to our team. Those that recognize these folks are on the front lines. They are putting their health and their safety, not only of themselves and with their families, at risk. And certainly would advocate that the community do everything we can to bend this curve. We are seeing a flattening, and that's great. At least we're not seeing the escalation we were seeing a week ago. Yet it's not sustainable, even if it's flat, knowing that the pace and the volumes are what they are today, not just at Baptist, but in all 3 hospitals.
Now, Mark, you just said something that I keyed in on. You said it's not sustainable, even if it's flattened. Elaborate on that. That caught my attention. What do you mean by that?
We currently are operating in an environment of shortage. We have a shortage of plasma, a shortage of remdesivir and other medications. We are in surge capacity right now. And often when we deal with surges, if there's a mass casualty event or a post-hurricane or other things, we spike up and we scale back down in a relatively constrained, limited amount of time. This is something that could extend indefinitely. And so it's very, very difficult to continue operating at this level for months and months and months, especially when it's avoidable.
That's a scary thought for the average person, because the average person thinks, okay, everything's fine. I'm not sick, but if I get sick, it'll be fine. Will we come to a point where we have to build temporary hospitals, in your opinion, like we've seen in some of the other cities, like tent hospitals, like MASH?
I certainly hope not. And I don't think it'd be that situation here in our community. Certainly hope not. We're not seeing that in other parts of the state that are seeing more spread than we're seeing. We are seeing other states, though, that are contemplating those types of decisions. And we know that in the Northeast and New York specifically, they propped up these temporary hospitals. They really weren't utilized. If anything, they were utilized for non-COVID patients, and the traditional hospital settings were focused on the COVID. I know that some hospitals, for example, in Texas, are dealing with some very difficult ethical decisions about how to allocate limited supplies of medicines for those that seem to have a better chance of survival. We of course, don't want to and don't think we'll get to that level here in our community. We have demonstrated that this community can bend the curve. We saw that in March and in April when this was ramping up, and recall that our community, we saw the 4th positive patient in the entire state of Florida. We now have over 450,000 individuals in the state of Florida positive. So we had patient number 4 in our community. So we've been in this fight. We ramped up quickly, and the community responded. And that first wave was really the patients that were in congregate living, like assisted living in nursing homes and prisons. But we didn't see the community spread. Now, unfortunately, we're seeing the community spread. That's now bouncing back into this congregate setting. So it's a situation that we don't want to get into if we can't, again, begin to see this curve go down.
Well, and that's a perfect opportunity for me to segue into the next thing I want to talk about with Eric and Janice. And, it looks like we've tested, according to the dashboard this morning, 61,613 residents in Escambia County, which is approximately 19% of the population. We've got 7,250 positive cases. Unfortunately, it looks like we've had 85 deaths, and we're at a total cumulative number of 383 hospitalizations. Now, as of this morning, I think the hospitalizations right around 340. 240? Is that about right, Eric?
Looking right there, around 238, yes, sir.
238. Okay, so 238 in the hospital right now, and it seems like Mr. Faulkner had alluded to that seems to be the level. That seems to be like where we're at. I mean, I've been watching that very closely every single day, and it seems like it'll go up, but then it'll go down. But it's like that's the level that where we're at, and that leaves us with about, correct me if I'm wrong, about 300 available beds between the 3 hospitals and the specialty center. And is that about right, Eric? Around 300 available beds?
Around 300, yes, sir. Absolutely.
Okay. But we just heard, of course, what Mr. Faulkner said about the sustainability of that without the appropriate levels of the remdesivir and all the other things that he needs. So that's a scary thing. So we don't just flattening it. It sounds to me, Mark, is not enough. We've got to flatten it. We've got to fully take it the other direction to keep you guys operating.
Yes, I am. Yeah, that's correct. We for the last 8 days or so, we've been at about this 240 level. A month ago, it was about 40, 45.
Right.
So we've seen a six-fold increase in the number of hospitalized patients. Again, that seems to have leveled. There are indicators that are encouraging. One of the first waves and data elements we look at are ER patients presenting with COVID-like symptoms. And we've seen that escalate and then begin to decline. It peaked around July 6th. The second wave are those that test positive. The third wave of those that are requiring hospitalization, and then four, those that unfortunately succumb to the virus and pass away. So again, early indications of with this COVID-like symptoms going to the ER, we've seen a downturn in that. We're hoping that begins to translate to a downturn in positives, likewise hospitalizations in those that die. So that's the data we're monitoring right now. And again, some encouraging signs that we might have crested or become close to cresting in the hospital.
That to me is very encouraging news. Now I know Escambia County, we've worked diligently. We've passed out PPE. We've got the advertising campaign that I see everywhere on billboards. Janice, how are we measuring the effectiveness of the Mask Up Escambia campaign? I mean, I know it's probably difficult to measure, but people have asked me, we're spending this money. Of course, it's federal money. It is not general fund money of Escambia County. It's not local taxpayers' money. It is money that's earmarked from the federal government for things exactly like what we're doing, the advertising campaign. So Janice, give us an update on that. How do we measure the effectiveness of Mask Up Escambia?
So there are things that we can do in terms of geofencing, so that whenever someone has gone past one of the billboards and then subsequently clicked on one of our campaigns, or if they've gone to a website and they have, clicked on the Mask Up to go to our pages to talk about, the other ways that you can take care of yourself, like you've discussed with the washing of the hands, the close contact, closed spaces, those kind of things. We do have a way to kind of monitor that. In terms of, how effective it is, I think that Dr. Glisson hit on this, and I was on a call yesterday with some of the folks from Baptist, Jen Grove, and, I think Mr. Glickman. Anyway, and one of the things that we talked about is the culture piece. I understand mandates. I understand that people think that's very important. But if we don't get to people's hearts and we don't get them to understand that if they don't respect others and love others and wear this mask for the protection of others, I think that you can, it's like wearing a seatbelt or anything else. You have to get to people's hearts, and they have to understand the consequences of their behaviors if they don't wear the mask. And so, anyway, we're hoping that the Mask Up campaign is having that effect. I would say that out in the county, before you would go in the stores and there wouldn't be anybody. Now the stores are demanding. Right. And so people are shopping and wearing it. I gave this story yesterday to the folks at Baptist I was talking to. I stopped to get gas at 5:45 a.m. in Cantonment, and there was another lady and we were both pumping gas, several stations away, stands away, and we both had masks on. And there was no reason necessarily, when you look at the social distancing and the other things, but we both did. Now, there were other people there that weren't, but I'm hoping that from our actions, maybe other people will also wear the mask, and see that. Anyway, I would just say that we've got to really get to people's hearts and get them to understand that wearing this mask, like Dr. Wade and Dr. Glisson and Mark and others have said, is to protect everybody. So, our hope is that it's having an impact. I did want to mention the other part that we're going to be working on is specifically having a conversation in the African American community about not waiting to go and seek medical attention. That tends to be the other thing that we're hearing, is that there are populations that might be waiting a long time before they seek medical attention. And so we're going to make sure that we hit that message home. Baptist, the folks that Jennifer Grove and then we talked with yesterday, that's a concern of theirs. And we've already been talking with WRNE and Community Health Northwest about making sure that we make that one of our next campaigns.
Yesterday afternoon, Allison Rogers sent us, commissioners, 3 versions of a potential strategy going forward, an action plan, if you will. One is based upon what Okaloosa County voted on 8 days ago. One of them is just a strong encouragement, and then the other one is more of like a hybrid of what some other jurisdictions have done. And I assume those are going to be added to our agenda August 6th. And this is the $1 million question that everyone wants to know, because, like I said, I'm trying to find the right strategy to go forward. And I'm conflicted because I'm a small government conservative Republican and have been since I'm 18. But this is something different. And I, obviously did recently attend the funeral of a family friend who died from this disease. He was in the hospital, and 7 days later, he's dead. Which one of those strategies, Janice, are you going to be recommending, if any?
Mm-hmm. I definitely think that Allison has put a lot of thought into the 3 different possibilities. I think it's up to the commissioners to consider which one they think best fits them and their district and the citizens. The only thing I would mention is that, as we've talked about enforcement, one of them does do the non-criminal citations. And from an enforcement standpoint, you already know that code enforcement has a big job already. And I think having them go around and do this type of enforcement is definitely going to put a strain on them. It doesn't mean that we won't do it, because that's our job. Our job is to implement the policies that the board passes. I just want to make sure that we set the level of expectation for the community that with the number of enforcement officers that we have, we certainly can't be in every single place all the time.
Sure.
I've already asked our community communications folks to make sure that we go on and create the graphics that we need to be able to put up in the windows and in the stores and things like that.
If one of those options were to pass, let me ask you this though. So, if for this meeting, those 3 options are going to be on the table. I would say we're going to have a conference call later this afternoon. We'll go over this in great detail. But I think from my perspective, I'm going to need data. I mean, it was great hearing from Dr. Wade. It's great hearing from Dr. Glisson and from Mark Faulkner and the others at the other hospitals. But this is a very, very difficult decision to make for me personally, and I know for the other board members right now. I don't even know that we have 3 votes. Let's just start right there. I don't know that we have 3 votes. I've heard others in the press and at meetings express their opinions. So I think data is always the key. So what I'm going to ask, and I'll just tell you this now, and then we'll talk about it again this afternoon at 4:30. I want to see a chart of where we can go right now in Escambia County where we have to wear a mask already. And that would be subject to the governor's safer at home orders, stage 2, where we're at right now, and other factors, individual organizations, businesses, and what that would look like if we instituted one of the 3, because I think we're pretty close to where we would be anyway. All the big stores that you know about, they're all implementing the mask order. With the only caveat being in county buildings. Right now, Janice, what is the policy, and are masks required in county buildings? Yes or no? And if they're not, maybe that's a starting place for us.
Mm-hmm. Yeah. So what we've done is, if you go to COC, whenever you go in, that's the place where we have all the building codes and inspections. When you go in there, folks do come in, and when I've been there, the public has been wearing masks. Our staff that comes in contact with the public, we've encouraged them to wear a mask. And so far, the ones that I've seen do wear a mask, and they also have a plexiglass in front of them. Our employees that working in vehicles.
And I get that. I don't mean to interrupt you, but I know we're running out of time, and I want to get.
Oh, I'm sorry.
But I mean, I'm talking about libraries. I'm talking about buildings where people come into the One Stop. Do we have a policy that says you got to wear a mask to come inside our buildings in the county? I'm not aware that we do. Do we?
We've not made a policy, but what we've done is we provide masks for individuals when they come in, and our staff, when they are coming in contact with the public, they are wearing masks.
Okay. So, I mean, that's part of the data that I want to look at. I want to look at what we could do, what's within our reach and our ability to do before we infringe on, people's rights. Is there a way to craft something that would allow people to opt out of business? For instance, maybe I'm a tattoo guy and I don't want to have that mandate, and I want to look at a lot of data, and I'm going to have a pretty rigorous list of things that I'm going to want to look at for the meeting on August 6th. If we're going to have a talk about this, it's going to be a deep talk, and it's going to be hours long, and we're going to go through it all in excruciating detail to make the right decision. The other thing I'm going to ask for is what we talked about, the hospitalizations on a graph, so we can see the hospitalizations and is it leveling off. The deaths seem to be going up. We just had 3 more today. I'm reading 6, and over the last 8 days, it's a large number, so that's concerning to me. But I also did, through a public records request, get a spreadsheet that's very interesting of the deaths in Escambia County since this thing started, and the ages, and I'm waiting on the comorbidities because I think that's an important data point. But I'm going to look at all the data, and I just want to know that, Janice, when we do this on August 6th, that's something you're going to be able to bring all this back up for all the commissioners so we can look at this from every angle as we consider one of those options. Is that something you'll be able to do for us?
Once you give me the list, we'll be happy to do that.
Outstanding. Well, we got just a couple minutes left, and these hours go by so quickly. But Eric, I want to give you a minute to give us an update. I know we have a tropical system heading toward Florida. Any chance that sucker gets into the Gulf and comes after us?
Absolutely. There's always a chance. The cone of uncertainty cover, if you look at the track for this morning, the center of that storm actually puts it on the West Coast now. So we need to watch that storm. Yes, we need to watch that storm. Everything seemed to be East Coast yesterday and even potentially recurving into the Atlantic. So absolutely, anytime we have that cone of uncertainty out there, it could fall within anywhere of those parameters. So absolutely, everybody needs to be watching this one.
And on the dashboard, and again, I want to publicly commend you for putting that dashboard together. And if anyone watching this, and these things, once we put them online and everything, it get hit by thousands of people. Anyone hasn't seen it yet, go to myescambia.com, and we've got a really very, very informative, interactive dashboard. And you can click on a lot of different things. You can find out hospitalizations, deaths. I mean, a lot of great information. A lot of the information I think that we'll be getting in a backup format for the commissioners when we make our decisions on August 6th. But thanks to you and your team and Janice putting that together. That's a great resource for the people. You're going and you're hunting for all this information from a lot of different places and putting it in one location for the citizens, and I just think that's very admirable. Dr. Glisson and Mark Faulkner, thank you for what you're doing. And please, Mark, please impart to your staff our great appreciation for the nurses, the doctors, and everything you all are doing. I mean, it's easy for us in the abstract to think, oh yeah, they're over there doing their thing. But I understand what you said earlier about the sacrifice that these people are making and the risks that they're taking. We hear about folks being infected and they're walking into those rooms every single day. So please express our gratitude from the county and from me. I appreciate what you all do. I greatly do. And an hour is over already. Janice, thank you so much. And I apologize, we didn't really get to a big county update. Eric, thank you for being here. Dr. Glisson, Mark, again, as always, it was great. It was great having you here. I appreciate the doctors that were here this morning and their time. I know it's very valuable. And we got some really interesting answers today, and I really appreciate it. So everyone, I hope you have a great rest of the week, and look forward to seeing everyone here next week at our next coffee. You all have a great one.